These sexually transmitted diseases, also known as sexually transmitted infections, are infections transmitted through sexual contact. Understanding and maintaining sexual health is crucial to preventing and managing STDs. Here's a detailed overview. Common STDs include bacterial infections, which are curable with antibiotics. Chlamydia, often asymptomatic, can cause infertility if untreated. Gonorrhea. Symptoms include painful urination and discharge. Untreated cases can lead to pelvic inflammatory disease. Syphilis. Progresses in stages can lead to severe complications like organ damage if untreated. Viral infections, which are manageable but often incurable. Human immunodeficiency virus affects the immune system, can progress to AIDS without treatment. Herpes simplex virus causes oral or genital sores, recurrent outbreaks. Human papillomavirus. Some strains cause genital warts, others are linked to cervical, anal and throat cancers. Hepatitis B affects the liver, can lead to chronic liver disease, parasitic infections, trichomoniasis. Symptoms include itching, discharge and discomfort. Pubic lice are also known as crabs, tiny insects that infest genital hair. Transmission methods include vaginal, anal or oral sex with an infected person. Skin-to-skin contact, such as with genital herpes or HPV. Sharing needles, which can transmit HIV or hepatitis B and C. From mother to child during childbirth or breastfeeding, affecting conditions like HIV and syphilis. Blood transfusion or organ transplant, although this is rare in developed countries. Many STDs are asymptomatic, but possible symptoms include unusual discharge from the penis or vagina, painful urination, sores, bumps or blisters on or around genitals, mouth or anus, itching or irritation in the genital area, pain during intercourse, fever, swollen lymph nodes, or fatigue, particularly in systemic infections. Testing and diagnosis. When should you get tested? Well, if you're sexually active, especially with multiple partners, it's crucial. Also after unprotected sex or a known exposure, and definitely during pregnancy. Testing methods include blood tests like for HIV and syphilis, urine samples for chlamydia and gonorrhea, and swabs from genitals, throat or rectum. Prevention. First, practice safe sex. Use condoms or dental dams consistently and correctly. Limiting the number of sexual partners can also help, and don't forget to get vaccinated for HPV and hepatitis B, for example. Routine testing is also key. Regular screenings are important, especially if you or your partner have multiple partners. Communication is another vital aspect. Have open discussions about sexual history and STD testing with your partners. Lastly, avoid high-risk activities. Don't share needles or syringes, and use protection even during oral sex. Treatment. Bacterial STDs are treatable with antibiotics, such as those used for chlamydia, gonorrhea, and syphilis. Viral STDs, on the other hand, are managed with antiviral medications, like antiretrovirals for HIV and suppressive therapy for herpes. Parasitic STDs can be treated with medications like metronidazole for trichomoniasis or with topical treatments for lice. Complications of untreated STDs. If left untreated, STDs can lead to infertility, particularly from chlamydia or gonorrhea. Chronic pain can arise due to pelvic inflammatory disease or infections like herpes. Some STDs, such as HPV, can cause cancers, including cervical, anal, or throat cancer. Furthermore, untreated syphilis or HIV can result in systemic damage, affecting organs, nerves, and the immune system. Mental and emotional health. STDs can significantly impact self-esteem and relationships. It's important to seek counseling or support groups if needed to help manage these mental and emotional challenges. Public health considerations. If you are diagnosed with an STD, it's crucial to notify your partners so they can get tested and treated as well. Always follow treatment plans completely to prevent drug resistance or recurrence. Additionally, participating in public health programs for education and vaccinations can help in the broader fight against STDs. Would you like information on a specific STD, testing locations, or detailed prevention strategies?